Hi, Vivian.
Hi, Trish.
Welcome. Welcome to Ride to Independence.
Yeah,
I'm so honored to have you here.
thank you.
So, Vivian, a lot of people are curious to know what is the difference between Alzheimer's and dementia?
Dementia is a term. When somebody has
Oh,
dementia, they have cognitive impairment. It's not just memory issues. They also have issues with difficulty planning and organizing. It affects their judgment and their ability to reason. Often it affects their communication, both what they take in and understand and what they communicate out, word finding issues. But it's a term. Now, people
okay.
understandably confuse Alzheimer's and dementia because the biggest percentage of dementia is Alzheimer's. But there are other forms
Right.
of dementia. There's vascular dementia, there's Lewy body, there's Parkinson's with dementia, but often people do exchange dementia and Alzheimer's. But keep in mind that dementia is a term, not a disease.
I see. I see. Well, that's good. That's good to know because people are always asking me what's the difference. And I say, well, I think dementia is part of the Alzheimer's umbrella,
It's a term.
really.
The
But
Alzheimer's
it's a
is
tone.
a disease. Parkinson's
Okay.
is a disease. Vascular dementia is a
Right.
disease of the brain.
Right. Exactly. Exactly. Because, in my business, dealing with seniors all the time, I do handle people with dementia. And sometimes it can be frustrating because they can be in the car with me and I can't really even have a conversation with them because they can't put sentences together.
Yes, yes, that's a part of the brain that's affected. Not for everybody, but for many people.
Right. Right. And I've also noticed the decline in my clients from when I first started. I was able to start a little conversation about what do you think of the weather? How do you feel today? What you have for breakfast? Now with a few of my clients is they can't even answer those simple questions.
Because it's a progressive brain disease. And by that
Right.
means that more of the brain cells are being killed off and the brain is shrinking. And we need our brain, a good, healthy brain to function. So various areas of the brain are then impacted. But sadly, Chris, that's the progression of this disease.
So once they've been diagnosed with dementia or Alzheimer's, there's no way of stopping the progression.
No, you can slow it down. Some of the medications slow it down, but they
Okay.
cannot reverse or stop it. And people do take other medications that are symptoms of these dementias, where anxiety or difficulty sleeping, agitation. So they're depressed. So there are additional medications, but there is no medication at this point in time um,
Right.
stop that progression.
Yeah, unfortunately, my mom died of Alzheimer's and she had it for 2 years. I think it was from the trauma that she experienced that caused her to go into Alzheimer's, but can trauma cause a person to trigger the brain somehow into that disease?
Since I'm not a doctor, so I really can't
Okay, yeah.
answer that. That's really for your the patient's neurologist to really be able to answer that question. There isn't a one size
Yeah, I
fits
just
all.
think because it Right, right, right. Well, I just think that she had a trauma and for some reason she ended up getting Alzheimer's, and my sister ended up taking care of her for 2 years, and then one morning she just didn't wake up, which
Yeah,
was a blessing,
yeah.
It was a blessing that that happened. Another thing that I hear about dementia and Alzheimer's is that she was also isolated. So they say like 30% of people, well, 30% of people get Alzheimer's or dementia from being isolated. Is a social component very important as we get older?
They don't get a brain disease from being isolated.
Right. Right.
The isolation doesn't help anybody. We all knew what that was
True.
like during COVID, right? Um, we need the socialization, we need the interaction, we need to be out and about. That
Right. Right.
all the research now indicates that in terms of our health and well-being. So it doesn't make things better for somebody with dementia to be isolated. When we're out and about, you get oriented, you get feedback from other people. It just
Right.
helps us in terms of our living. It validates us. So without that, people can get depressed. They can ruminate. And especially given with a form of dementia, you need that orientation and you need that help. If
Right.
you're
Right.
isolated, it's not good. It's not good. Dementia doesn't, I'm going to segue into something else. Dementia doesn't just affect the individual who's been diagnosed. It affects those around them that take care of them. And it is work. It is work to take care of somebody with dementia
Right.
because of all that effort you're doing to care for them. So the reverse is without that care, that person is not going to fare well. It can't. Look what happened to
That is
James Cameron when his wife died. He was by himself for, I think, over a week.
right. Right. Gene Hackman. He was by himself, what, 5 days? And
He couldn't take care of himself
he couldn't take care of himself.
at all. You know, uh,
Right.
you know, when you're at that point, you don't know how to prepare a meal. You might not even have a sense of being hungry, or what to do about it.
Oh, really? You don't even think you have a sense of being hungry?
You know,
Unless you're told, "Okay, we're gonna have dinner now, we're gonna have
it's not
breakfast
for
now."
everybody, but you know,
Right.
you don't know how to take care of yourself. You
Right.
just don't when you have aggression.
Right. Right. And I'm actually kinda well, she was young. I mean, she was young, she was in her 60s. I guess that's why they determined not to have any help, because she was young herself,
Yeah, and that's what you see
the wife.
people like.
Yeah, yeah. What keeps you motivated to keep going? Because you've been doing it for 25 years. You've been helping caregivers learn about dementia and other families too, right?
You know what? I think I'm basically a born caregiver myself. So I identify with those who are caregivers and how, when I started, I headed an adult daycare program. And it was fascinating to me. I knew very little about dementia, but the staff and volunteers were so engaging to that person with dementia. They didn't
Right,
relate to them as if they were a disabled person. They related to their ability, and I learned how they really connected with them in that moment, in their moment.
right.
But
Mhm.
at the same time, I became aware of the impact the disease was having on both their family caregivers, and we had paid caregivers in our program. And it's a lot of work to be a caregiver with somebody with dementia, because often you're dealing with somebody who's not reasonable.
True, yeah. I mean, they can also get a little bit, frustrated. They can get, a little angry. They can lose their temper a little bit. And, this is what I hear a lot. They become very accusatory. They start accusing people of taking things or yeah, I mean, taking things, stealing things. And I'm like, I don't know where that comes from, but I guess you
But
explain to me why that happens.
it doesn't make sense to them as an individual. because up until they were affected by the disease, they were mostly, I'm assuming, independent,
Right.
responsible adults that were in charge. Many of them raised families, uh, worked. So to use something for something they
Right.
work and they don't understand that. So it couldn't be them. They were never irresponsible. They never misplaced things. So they're really, unfortunately, because
Right.
of the impact of this disease on the brain, for them, it makes no sense. So it couldn't be them, has to be you. You must have taken something. You must have misplaced it. And
Right.
what becomes challenging is, as an example, when we know that they shouldn't be driving anymore because it's not safe,
Right.
we don't see that. They've always been a good driver. They know what they're doing. So to take the keys away really doesn't make sense to them. And they don't have the capacity anymore to
Right.
evaluate their ability.
Right.
And
Right.
that's where it becomes
Well,
so challenging for others who are responsible for their care.
let me tell you, now that you mentioned keys, I have a brand new client that came on, and I sat down with her, the mother who has the dementia, and the daughter, and I feel so sorry for her because she's a brand new mother. She had the baby in a stroller, and I'm sitting with them, and I can see the anger in the mother, and anger and hate for the daughter because the daughter took the keys away from her and wanted to hire me to start taking, the mother to places. She couldn't understand why the daughter was treating her like that. And she even pointed, she says, "Oh, she's not my daughter. She's not my daughter anymore." I wanted to start crying because that was just so hurtful for her to do that to her daughter who's going through what she's going through. Obviously, a brand new mother, so her hormones are still out of whack because she's breastfeeding and she has a baby 3 months old, 3 months old. And the mother is treating her like that. It was I found it very painful, and, I try to mention to her that, the reasons why she couldn't drive anymore, of course, and, she just wasn't gonna have it. She just wasn't gonna have it. And I did take her out the first time she did. I was sweet enough to get her to agree, and, so she agreed to one transportation service. I was taking her to the doctor's office, and I got cut. I got cut short. Someone literally was cutting me to get in my lane, and it scared her. She went, "Oh, oh, look at that idiot," or whatever. And I say, "Do you understand why you cannot drive now? I happen to be I happen to know how to drive in these situations. I'm a lot younger than you. I have the speed, the velocity of my dexterity to get around. I have those abilities. Can you imagine if you were driving? This person could have hit you. So there's a reason why your daughter hired me to bring you safely to your appointments."
Right, right. It's very,
And just think of me as the chauffeur, I said. I'm your personal chauffeur.
and that's what you were doing. You were doing a technique which is called deframing. You identified yourself as her chauffeur. And that was something you could kind of think about. Like a chauffeur is a fancy lady. And
Yeah,
so you changed the direction of that conversation to something that was more positive and got her off the track of her anger and her frustration
yeah,
with her daughter. And that's one of the techniques that I use in giving advice and guidance to my caregivers. You can't reason with a person, or you can't change how they're reasoning. Their brain has
Right.
changed. So it's a different way of relating. And
Yeah, exactly, exactly,
what you
and I think
stretch
yeah.
is so much the life of those who are involved in caring for somebody with Alzheimer's. It's very complicated. It's very frustrating, and it's very sad.
Yeah, yeah, it is, and I think it's been over the years that I've been doing this business that I learned what terminology to use with these people, and she was another thing she was worried about, "Well, who's gonna pay you?" Well, I can't afford to hire anybody to take me around, and, of course, I what I tell all the families is, "Oh, I'm a volunteer." "Oh, you don't have to pay." "Oh, no, you're not paying me. Your taxes paid for me. All your life, you've been paying into taxes. I'm a volunteer."
Exactly.
And, of course, that also she also liked that.
Exactly. But you know what? It got you literally to where you needed to go to get off of that negativity and accomplish your goal. So
Right.
these are the important techniques, and as you say, you learn through the years how to respond.
Right, right, exactly, exactly. But it was like so she was like, "Oh, okay. Oh, okay, okay." So then she started real, being, "Okay, I think I can, take on a chauffeur." But, so another question I have for you is, can you explain well, what do families do when they realize that their parent's been diagnosed? It's just been diagnosed that their parent has Alzheimer's or dementia. What are the first steps that they should be taking?
Well, that's a very good question. Really, the first steps that need to be taken are you need to do some planning. And that really means you need to get your legal documents in order. While the person might have capacity to make decisions, you need to establish
Okay,
power of attorney, a healthcare proxy, advance directives. This is while the person's alive, not a will. Um, so that you are honoring what their wishes are, and you're setting
right,
up a way to take care of. So that's critical. And
right.
also financial planning. So many adult children um, have never had this conversation and really don't know what their parents' finances are. Alzheimer's is an expensive disease, and you need to know what the assets are, what the savings are, what their monthly income is, if they get pensions, so that you can plan accordingly for health.
Yeah, but these people well, families should be doing this, yes, before the parent has any type of diagnosis
But it's
of Alzheimer's or dementia. So, I think maybe in their 50s, in their when they're in their 50s, the children should be sitting down with the parents, "Hey, mom and dad, let's talk about your future. What do you have in place?" And
people should.
I think that would be a good idea
People
too.
should, and maybe they will going forward, but most people don't. If there's
Yeah,
an issue or a crisis, then you have that conversation. Most people are just busy
right,
living their life, like this woman who just had a baby. That's her focus right now. Um,
right.
so financial planning is important, and also people might be eligible for Medicaid, which is a reality. And there is a 5-year look back. You can't just, have $1 million and give it away and then say, okay, now I want to be on Medicaid. So the first steps are legal planning and financing. And um, also, it's important to become educated, really
Yeah.
understand, do your research. What are the programs out there? What are the services out there? What is my spouse or my parent entitled to? Were they a veteran? Are there veteran benefits? But in our area, especially in Bergen County, we have a lot of programs and service. And it's important to become educated about what's available so that you have the tools and you have the support. Um, those are the steps, the first three steps. Because I want to underscore, um, it, this is not, you can't care for somebody with dementia by yourself. You can't. It's too emotionally draining. It's too physically responsible. This starts off literally as a part-time job and then
Right.
a full-time job. And who are we talking about? People like you mentioned, somebody in the sandwich generation who has to put money aside and time aside to take care of their own families, perhaps work, or they themselves are elderly. This is a physically demanding job. As we talked about earlier, the patient's not rational. You need to be willing to accept help from others. Nobody can do this on their own. They need somebody like you to come in and relieve them, or somebody, I talk often with women who were not responsible, as an example, with their finances. Now their husband has dementia. They were never involved with the family finance.
Wow.
So now they're taking on at 70 or 80 years old a
Right.
very demanding new responsibility. So, when I'm working with families, it's also helping them to accept maybe having somebody do the driving, or maybe
Right.
um, hiring somebody to do the financial planning and the daily money management for them.
Right.
Please
Right.
off your plate. It's very important to know we have great adult daycare programs in our area. We have
Mhm.
other programs, especially Bergen County now. The Division of
Right.
Senior Services has a dementia-friendly program where they're educating people in libraries and giving them skills to manage and support that they have. So, as people get the diagnosis, it's very important to become educated and get support for themselves.
Sure. 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 So I also know that you train caregivers about how to handle dementia and Alzheimer's because
Yes,
people need to hire caregivers.
people need to hire caregivers. And Trish, you want to look when you hire somebody for the best match for that person. But as you identified earlier, as the disease progresses, the care changes. And somebody who might have had the skills to take on somebody earlier on needs more
Mhm.
skills as they develop. And that's where I come in and do training for paid caregivers so that they can stay with that person throughout the progression of that disease.
Mhm.
Most caregivers are angels in what they do. It's very committed to it. It's just my helping them to do the care that's needed and to do it well.
Right. So let's go over again the three steps that families should be doing when they find out that their parent has the beginnings maybe of Alzheimer's or dementia. You mentioned a power of attorney, you mentioned financial planning, and what was the third one?
And also to become educated about what the resources are, what the
Become
programs and
educated,
services
right.
are. uh, caregiver support group.
Oh, the
Nobody is a
programs? Right, what the right,
so, look, it's new for you, but you're not alone in this process. There's support services out there for you, and that's where people have to become educated. But I want to step back a little bit because
okay,
um, when you see that there's a change, the first thing that you need to do, the very is to get a thorough medical workup to determine what is going on. That's going to be primary and having a thorough, comprehensive workup. It might be determined by your internist that you need to be seen then by a neurologist. And the neurologist has a full battery to determine whether there is cognitive impairment. That is the very first step to take because this is a medical disease, a disease of the brain. So you want to see is there a change? Is it depression? Is that why you're becoming more forgetful and they're self isolating? Or is it that there is cognitive impairment going on? That's the
right,
first step you need to take. You evaluate medically what is going on with that individual. It's not
right,
just,
exactly,
oh, they're getting older.
right. Well, they used to call it senile.
It's not.
I remember I remember when I was a little girl, my grandmother could have had dementia. We don't know because back then, they didn't have a word for dementia or Alzheimer's. We used to say senile, and they used to say, "Oh, uh, Trish, we saw your grandma on the street." And we used to say, "Oh, don't worry about her. She just senile." I mean, I was a little girl. I didn't what did I know? But, that's what they used to have, and nobody knew that it was dementia or Alzheimer's, didn't have a name for it, let's put it that way.
Mhm. But there's a difference between normal aging, which includes forgetting, having what we call senior moments. You walk in a room like,
Yes,
what was I looking for? Or where did I
right.
put my cell phone or my
I think we
keys?
all have senior moments.
We
Yeah,
all have that, but that's not necessarily an indication that you're going to develop dementia. Dementia is a
okay,
part of the aging. It's a big percentage, but it's not
okay,
everybody as they get older becomes senile. But if there are signs of it that has really serious functioning, you know, it- it's annoying to go in a room and say, what am I here for? But it doesn't affect your functioning. When it affects functioning, or it's like your grandmother out on the street, maybe wearing inappropriate clothing. Maybe she's just still in her pajamas. Then there's something to pay attention to. That's just not normal age.
right, right,
You
right.
should focus.
One more question before I let you go. What do you think about the injury to the brain with all these athletes, like the football players? They become their brain becomes damaged, and they're still young, obviously. These people, these professional athletes are in their 30s, 20s, 30s, and then they're starting to what are the likeliness of them developing this disease because of their injuries that they had when they were younger?
Yeah. Look, a hit to the head is going to cause damage. It is. And especially if it's over time. Look what happened to Muhammad Ali.
Yes.
That was hits to the head. So, yes, and there's a lot of conversation, especially with pediatricians, about helmets and certain sports that kids should not be involved with. It's not good to be hit in the head over time. It's just not
Right,
avoid it.
right. Well, that was one of the reasons why I did not allow my little boy, who was so tiny, first of all, to ever play football. I said, "No, I'm sorry, you're not gonna be playing football. First of all, you're too tiny." And, so I veered him towards, obviously baseball, soccer, combative type sports.
Yeah,
But
it's
Vivian, thank you.
it is our
Yes,
responsibility, when we're taking care of somebody to make those decisions, and they're not easy ones to make. Uh, they're not. Um, I did the same thing with my daughter, playing soccer when they're supposed to hit the ball over their head, and it was like, no, you can use your foot,
yeah,
but don't use your head.
yeah,
So yeah,
yeah.
I'm so glad
Well,
we had
any
this conversation. Thank you.
Yes, I
Yeah,
mean, these are important questions. They're simple questions that people ask, and I'm so glad that you had the time to come in and speak to all of us about this and giving us some advice, steps on what families should be doing. It's important that people start talking about this with their families, their parents, even though the parent might say, "Oh, I'm you don't have to worry about me. I'm too young or I'm not ready," or, they might just be in denial. Well, a lot of parents are in denial about it. And it becomes a struggle with the families. It becomes a struggle to the child. And that's just part of aging that people have to realize and focus on. And it might happen to your family. It
exactly.
might happen to your family.
I applaud you for opening up this conversation so that people do get informed and they have some support for themselves because the percentage is high and it's becoming more explosive in terms of people getting dementia. And what we talked about this morning, the impact it has on families. So thank you.
Yeah.
Thank you for what you do also.
Thank you. Thank you so much. One more thing I just remembered. There's been studies or people or professionals are saying that when you're in your 50s, entering your 60s, you really should activate the brain more by learning a new skill,
Yes.
either a language, an instrument, take on a hobby. Keep your brain active at all times. Don't be stagnant. Just don't sit in front of the television when you retire and do nothing because your brain is a muscle and it needs to be worked on. So always be engaged socially and physically. Physically also because we want that blood to go to your brain.
What's good for the
Last
heart is good for the brain, and, absolutely, you know that expression, if you don't use it, you lose it.
That's right. If you don't use it, you lose it. So people use it, use your brain, use your body, be physical, and learn a new language or take on a hobby. Even if it's just volunteering, you're still learning how to volunteer
Right, right, and it can
wherever
be
you're going, right?
and it can be fun, you still
You're
learn.
still learning how to do something new.
Right, it's fun, and that's the way you approach it, so it's all good, and I agree with you. It's very important. Yeah.
Vivian, how can people get a hold of you in this area? Now, if you're in California or you're in Texas, please speak to your doctor, your internist about your parents. Take these 3 steps with your families. But Vivian, you're over here on the East Coast in New Jersey. But can people hire you also through maybe
A big part of my
phone?
practice that opened up during COVID was that I work virtually. So I have many
Oh,
clients, I'm more the boots on the ground in this area, but I have clients all over the country, and I've had international clients that call me that don't live in the country. So
wow.
absolutely, I have a website. Are you posting that information, or do you want me to just?
I will be posting your website and your phone number in the bio in the link of this video. So Vivian's information will be linked in the notes. so they can get a hold of you, Vivian.
Absolutely. My
But
pleasure. My pleasure. Nobody should be on this journey by themselves.
yes, very good. All right. Well, thank you everybody for joining us on Ride to Independence. And it's important that you get out there, stay active mentally, physically. And Vivian, thank you so much for coming. Everyone, have a great day. Bye bye, Vivian. Thank you.
So long.